the hip bone, also known as the ossa coxae, and I'm going to be doing the origins. So we're going to have our gluteus maximus, gluteus medius, gluteus minimus, tensor fascia lata, and we're going to have our piriformis, our gemellus superior, gemellus inferior, obturator externus, obturator internus, our adductor magnus, adductor brevis, and adductor longus, as well as the gracilis. We're going to have the biceps femoris long head and semitendinosus, the semimembranosus, and the quadratus femoris. Then we are going to have our pectineus over here, our sartorius right there, and then these two are both going to be our rectus femoris. And then on the back, we're going to have our erector spinae and our iliacus. This is the femur bone, and I'm going to be going over the origins and insertions. First, I'm going to do the origins. So we have our vastus intermedius, our vastus lateralis, and our vastus medialis. Then we have the medial head of the gastrocnemius, the lateral head of the gastrocnemius, the plantaris, and the popliteus. And we also right here have the biceps femoris short head. That is all of our origins. Now we're going to go to insertions. We're going to start with our gluteus maximus right here. Then we have our gluteus minimus and our gluteus medius. Then we have our piriformis. And our go-go muscles are going to be inserting right here. Over here is going to be the gemellus inferior and the gemellus superior, as well as our obturator internus. And our obturator externus is going to be right here. Then we're going to have our quadratus femoris and our iliopsoas. Then we are going to have our adductor magnus, which goes all the way down and jumps down to here. Then we have our adductor brevis and our adductor longus. And lastly, we have our pectineus. This is the tibia, and I'm going to be going over the origins and insertions. I'm going to start with your origins first. So we have our tibialis anterior, our tibialis posterior, our soleus, and then our flexor digitorum longus. Right here we have our extensor digitorum longus and then our fibularis longus. And that's all for origins. Now I'm going to go to insertions. We have our popliteus, our semimembranosus, our vastus medialis, our semitendinosus, gracilis, and sartorius. And then we also have the iliotibial tract.